I'm cleaning my equipment. I'm checking the door to see if they have any precautions.
Come in.
Hi, my name is Nurse Kay. I'm going to be your nurse for today. I'm going to be talking to you about care for your ankle, and I'm going to just be assisting with your care for today. So I'm just going to wash my hands over here. Washing my hands at the sink. Alright, and I am just writing my name here on the board. That way you know my name for reference for later. Okay. Putting on my gloves. Okay. And can you say your first and last name for me, please?
My name is DM.
Do you have any allergies?
No.
Latex at all? Nothing?
No.
Okay. So I'm just going to put down a paper towel barrier. Put my items here. Okay. I'm just making sure your bed is in the lowest position here. And you have your side rails up here. I'm going to be looking at your room. Just making sure the environment is clean. Okay. And then I'm going to be bumping your bed to make sure the wheels are locked. Okay. So before we begin, is there anything you need help with? Do you need any water or any pain medications?
No.
Do you need help getting up in bed?
No, I'm fine.
Okay. So I'm going to start. I'm going to start by doing your vitals. So I'm going to go ahead and take your temperature. Okay, if you could just open your mouth, I'm going to put this underneath your tongue. Okay, and while we're doing that, I'll take your pulse ox using your index finger. Okay. Okay, I'm going to do your blood pressure. Before I begin, I have a couple questions for you. Have you had any accidents in your arms?
No.
Have you had any breast or chest surgery?
No.
Okay, I'm looking at your arms for circulation, any dialysis, any edema. Okay. And I see that you have your IV on your right arm, so I'm going to go ahead and use your left arm for your blood pressure. And I just cleaned my equipment when I was outside the door. I'm just going to do your pulse. This is going to be a little cold, so I'm going to rub it on your gown here. do you have any pain at all?
My pain's about a 7.
So your pain is a 7?
Yes.
Okay. When did your pain start?
When I was playing basketball and stepped on someone and my ankle went in.
Oh, okay. And then that's how you got your ankle fracture?
Yes.
Okay. So your pain is in your ankle.
Yes.
It's in your left or your right one?
My right.
Okay. Alright, and then is this constant or does it come and go?
It's constant.
Okay, and then how would you describe it? Is it dull? Is it sharp? Is it radiating?
It's radiating up my leg.
Oh, okay. And then what aggravates your pain? Like what makes it worse?
When I put pressure on my ankle.
And then what makes it better?
Just by resting.
Okay, and then are you taking any medications at all for your ankle?
No.
Okay. Do you need me to go get a nurse or go get any medication for your leg for the pain that you're in?
No, it's fine.
Okay. All right. So I'm actually going to be looking at your ankle. Okay. I'm going to be looking at both of your legs. Okay, so can you wiggle your toes for me?
Wiggle toes.
Okay. And can you push up on my leg? I mean, can you push up on my hands?
Push up.
Can you push down on my hands?
Push down.
Okay. And then I see your ankle's a little red here versus this one, but that makes sense because of your fracture. I'm going to just do a capillary refill here. Check your pulse. Your temperature. Checking your temperature. And you do have a little bit of edema on this one. It's a little swollen right now. Okay. Change my gloves. My gloves are changed. Okay. So now I'm going to be checking your lines here. Now, you, okay, so I'm going to be checking, your lines here. So you have IV in your right antecubital. Alright. Okay, so I'm looking at the gauge. Looking for any swelling, or redness. Do you have any pain at all in your arm?
No.
Okay. And then I'm looking at the tubing to make sure there's no kinks in it. It's opened, like it's not clamped here. And looking at the IV solution. So you have normal saline running right now. It's at 150 milliliters. And it's within expiration date. It's clear. Okay. And then I'm gonna be looking. It says you have Foley, so I'm just gonna look at your leg here for Foley. Okay. For Foley, it is taped to your right thigh here. I'm just looking at the tubing. You have yellow urine going through, yellow clear going through, and you have 60 milliliters left in the bag. Okay. There's no kinks in it, there's no extra lines hanging, so there's that. And you have a 16 French. Okay, so now I'm going to change my gloves again. Okay, so now we're going to be doing a neuro check. Alright, I'm gonna be doing a neuro check. Okay, so I've already asked you your name. What is today's date?
March 31st, 2020.
And where are you right now?
Advent Health.
Okay. And I'm going to be making a pen light here. Okay. Okay. So, can you look at the tip of my nose here? Just going to be measuring your eye. Okay. And then I'm going to be shining a light in your eye. If you could just continue looking at the tip of my nose. Okay. And can you smile for me, please? And then can you stick out your tongue, say ah. Okay. Alright, and your mouth is pink and moist, so you're not dehydrated. And do you have any difficulty swallowing at all?
None.
Okay, and I'm just going to be pinching your skin here, just for your skin turgor to make sure that it goes back within 3 seconds. Okay. And have you been coughing lately?
No.
Okay. No coughing. And I don't see any shortness of breath or any labored breathing. Okay, so I'm just gonna be listening to your lung sounds. Okay, so just whenever I put my stethoscope down, I just need you to breathe in and out for me. Okay. Okay, so for me to hear the back, I know it's going to be a little hard with your ankle to lean forward. So I think it might be better to kind of turn you to the side. So I'm just going to put this down some. I'm not going to use your pillow here. Alright. And then you can just be with your ankle. Okay. Okay, and then I'll just okay, so I'm just gonna be doing your an inspection of your abdomen. Okay, so I'm just looking at your stomach here, looking for any redness or distension, anything like that. I don't see any. And then I'm gonna be listening to your stomach here. Okay, and I'm gonna just be palpating your stomach here. So whenever I push on your stomach a little bit, you just let me know if you have any pain or tenderness, okay? Any pain or tenderness?
No.
Looking up at you to make sure that you're not in any pain. Any pain or tenderness?
No.
Any pain or tenderness?
No.
Any pain or tenderness?
No.
Okay. Alright. So, when was your last bowel movement?
Earlier today around 11, maybe.
Okay, so it was earlier today. And what was the amount? Was it a normal amount for you, a small amount, a large amount?
It was a normal amount.
What was the color?
It was a light brown.
And then the consistency of it, was it firm? Was it hard? Mushy, soft?
It was firm.
Okay, and then when was the last time you passed gas? Like, would you say it was today or?
It was today. I just don't really remember.
Okay, yeah, that's fine. And now I'm just gonna be testing, doing a range of motion in your arms here. Can you squeeze my fingers?
Squeeze fingers.
Okay. Can you push up on my hands?
Push up.
Can you push down on my hands?
Push down.
Okay. And then, can you wiggle your fingers for me?
Wiggle fingers.
Okay. And then can you see the color of your hands here? Okay. And, just gonna be pinching your fingers here for your capillary refill, which went back within 3 seconds. And the temperature. I'm gonna change my gloves. Okay. And your pulse. Okay. Alright, do you feel any numbness or tingling anywhere in your body?
No.
No? Okay. So I have a little bit of a patient teaching that I have here for you. Okay, on my laptop here. Okay. So we're going to be doing a little bit of a patient teaching on just some different things for caring for your ankle. So one of the things is this will help with your pain management. Applying cold pressure to your ankle, that would be really good for it. In fact, you use a bag of ice. You could use frozen peas. You can use an ice pack. You just apply that to your ankle, for about 30 minutes at a time, and you remove it for an hour. So it's 30 minutes on, an hour off. And that'll help with your pain, and it'll make your swelling go down as well. Also for your pain, you've been prescribed Lortab, which I'm going to discuss a little bit more with you regarding that. And then for your activity, the physician has actually prescribed that you have strict bed rest. So that means you can't bear weight on your ankle. So you want to avoid getting up, and you want to keep your ankle elevated for 2 days. And you want to keep it above your heart to reduce swelling. So you want to use the Rice method, which is resting, icing, compression, and elevation. So, and then after the 2 days, you can get up by using your crutches, which I'm going to tell you a little bit more about. During this time, you can use the exercises that I'm about to tell you about on both your legs as tolerated, which means until you get tired or you can't handle it any further. And you can continue to do this until your ankle heals, as well as going to your follow-ups. Okay, and then for caring for your ankle, you just want to follow the instructions regarding your activity. So you want to make sure that you move. You also want to make sure that you move slowly. You don't want to get up too fast or anything, or lose your balance. Use your crutches appropriately and correctly. I'm going to be teaching you how to use them, so you'll learn the correct way. Use your pain medications as directed. So just take them when it's been directed on your bottle. The range of motion exercises I'm going to be teaching you in a little bit. You do those, after you've had the 2 days of bed rest, you can get up and, like, after the 2 days of bed rest, you can get up and you can walk using your crutches as early as possible, so that'll promote your healing. The faster you start walking around and everything, it'll help with your healing. And then I have some resources printed up for some medical suppliers and some drugstores where you can obtain some more elastic bandages and braces as you need them. Okay? So I'm going to be providing you with all this information about your ankle. Let me just put this away. Okay, so I'm just going to lower your bed back, making sure it's still locked. Get your 2 side rails up. You have your bedside table still next to you. Got your water here, your items, and your items here. And before I leave, is there anything that you need me to help you with?
No.
Like regarding using the bathroom? Do you need more water?
No, I'm fine.
Did you need any pain medications for your ankle?
No, I'm okay.
Okay. I'm just making sure the room is still clean. Okay? Well, if you don't need any help, here's your call bell. You press this button right here and I will come running. But other than that, I will be here every hour to visit you and check on you and make sure that you're okay. And, that's it. Okay, so bed's back in the lowest position. I'm taking off my gloves. And I'm washing my hands. Okay? And, I just want to thank you for allowing me to participate in your care today. And before I leave, do you want your door opened or closed?
Closed.